Time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So folks, let me ask you a question. What is seasonal affective disorder? What's a seasonal affective disorder? Well, today we have no stranger to, as he says, television land, Dr. Philip Benyo Sr. From the Lehigh Valley Health Group, Physician Group. He's here to just talk about this seasonal affective disorder. That's interesting, isn't it?
It is interesting, and it's in an epidemic, Sam, this time of year. Seasonal, of course, is straightforward. We're in the winter blues or the winter months. The affect is your mood, whether you're anxious, depressed, and the disorder, of course, tries to describe the thing. So the so-called SAD syndrome, seasonal affective disorder, describes what a lot of people go through this time of year living in northeastern Pennsylvania.
All right, now, does this thing just happen?
Well, yes and no. The same thing that put a bear to sleep for 3 months, hibernation, is what happens to us, to susceptible individuals. We go into hibernation. We don't want to get out. We feel depressed. We feel sad. We start munching more, carbohydrates, comfort foods, gain weight, and it generally continues until the spring.
Okay, before we get into the symptoms of if someone should have this, if you're active, okay, if you get involved and you're active and you know at least visit people, talk to people, sometimes people go out for dinner, not necessarily to eat, but to socialize. Okay, it's like a psychiatric type thing, just to be with people. Okay, should that be something that people should be doing, getting involved, doing things?
No doubt. That's good insight, Sam. And it's sort of the cornerstone of therapy. Because let's face it, it gets darker earlier, it stays darker longer, it's colder, and you don't want to get out. So you can go into hibernation like our bear. And so what you want to do is to try to fight that by getting out, becoming social, because that socialization is crucial.
Well, I remember a few years ago, my wife and Sammy and Janine, we were on vacation, and we're coming back, and before we came back, we were in the airport, and we went and got some beverages, and this waitress had a sign on, or a little note on her lapel that said, "Attitude is everything."
Boy, that says it all.
And when you start getting into this attitude, if it's around this area, I think misery loves company.
Yes.
So I got a pain, I got this, and then it's like, let me top this. Oh, you think that's bad? I have this, I have that, and all of a sudden they start bringing them down. Not that they don't have those pains, but the problem is they emphasize them and magnify them. Am I correct?
There's no doubt. And you don't even have to go outside the area. Turn on, except for the Sam Lesante Show, turn on television, and all you see is litany after litany of bad news that brings you down. And whether it's on a national level or an international level, let's face it, there's a lot of misery out there.
What was the name of the doctor or the person who was told that he had so many months to live, but then he started watching the Three Stooges, the Marx Brothers, and he started, who was that? I don't forget.
I don't recall the gentleman, but I remember the
story. And he
story.
extended his life like 2-3 years because he just surrounded himself with laughter and humor and only was around positive people.
And there's no doubt, I just did an article for Lehigh Valley on laughter being the best medicine. And it actually releases in your brain the same kind of things that sometimes drugs do, those good feeling types of things. So laughter really can be the best medication.
So you got to get up in the morning, and I used to tell my students when I was teaching, sing in the shower. Sing in the shower. What do you mean? Sing in the shower. Just get and look at that mirror and tell them that you're just wonderful and things are going to move on. Now look, it's not a cure-all for everything, but at least it gives you that mood.
Absolutely. Over the holidays I was watching Bing Crosby, White Christmas.
Yeah.
And one of the best songs is when Bing Crosby is singing, "When I have trouble going to sleep, I count my blessings instead of sheep."
Yes.
And that's all there is to it.
And I feel sorry for people who are just engulfed with negative. I know elderly people, when they're not feeling good, they're not really in the best of moods. But if somehow they could just read something or count their blessings, their children, their grandchildren, whatever, just to start getting into that mood. All right, with this seasonal affective disorder, what are the symptoms of this?
Good question, Sam. There's several of them, as you can see on this screen, and some of them actually mimic depression. And of course, you feel sad. You might have a change in mood, a loss of interest, a withdrawal from activities, sometimes difficulty concentrating, fatigue, lack of energy, the need for more sleep, and again, that comfort food.
Sammy, go back a seat, okay? I just want to go back. When we look at sadness, okay, and we look at each one of these here, okay, what would be your prescription for people who are sad?
Well, first of all, you need to rule out another medical illness. Perhaps it's your thyroid. Perhaps you have another medical illness. And I think that's the key of today's program, is if you're having these symptoms, seek out a healthcare professional, first of all, to see if you're depressed, or to see if you have this syndrome, which is treated differently than depression. It's not like I'm going to pull out my prescription pad, Sam, and give you an antidepressant. This thing, it responds to what you said earlier about socialization, but it also responds, believe it or not, to light therapy. And they actually have great treatments for pulling yourself out of this by simply getting more exposure to light.
You know what I do at home, and not that I have a stock in PPL, but I make sure that when I'm in the area I'm in, I make sure the lights are all on. I make sure, I don't want to save 50 cents a month, but I want to make sure that it's bright and it's just to put me in that mood, okay, especially when it's dreary outside and there's no sunshine.
And that's the key. That's the key, is light therapy. They actually sell these things on the internet or at Amazon, where you have a special panel of lights. Now, we're not talking tanning booth lights, because that has ultraviolet light and skin cancer risk. We're talking about a different set of lights that you expose yourself to every morning for several minutes, and that is the standard of treatment for this illness.
What are some of the causes of this disorder?
We're not really sure, but by and large, it has to do with exposure to light, or better yet, the lack of exposure to light. As I mentioned, it gets darker earlier, stays darker longer, and we're very sensitive to that. And again, the same thing that puts the bear in hibernation, we're sensitive to the light. And so you don't go out as much. Let's face it, it's cloudy. I think there was a stretch there where there was 2 weeks without any sunshine. I mean, who wouldn't feel sad?
Yeah. Oh, what do you do?
What do? I do? I sing in the shower.
Okay, folks, I'm talking to Dr. Philip Benyo. You know him. It's Your Health. And remember one thing, the ratings are coming out. So you and your wife and your son, beware, okay? If that It's Your Health ratings are higher than the Sam Lesante Show, bye-bye. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, all of our health shows are on ssptv.com. My email is sam@ssptv.com. I'm speaking with today on the show Dr. Philip Benyo, certainly no stranger to SSP TV with his television show, It's Your Health. And we're talking about seasonal affective disorder, folks, and we'll get into the flu a little later on. So, okay, once again, for those people maybe just, what is that seasonal affective disorder again, Phil?
Yeah, what it represents, Sam, is starts in the fall, and as the days get shorter and the nights get longer, we then fall into a depressive type of illness, a depressive type of syndrome, characterized by feeling sad, first of all, feeling depressed, becoming withdrawn, maybe having some difficulty concentrating, remembering things, not wanting to go out, and just kind of starting to hit comfort foods and gaining weight.
Well, now this is, the causes are, you just mentioned some of the causes, okay? Now, this is interesting. Who, and I think we have a slide on this, who will be affected by this disorder?
For reasons we're not clear, Sam, as it states there, almost 75% of the time we see this in women. And contrary to what you might think, it's usually a younger crowd that's affected by this type of thing.
I see. The main age is between 18 and 30.
Right. You know, sometimes I think we don't give our elderly enough credit. Because you know what, one of the things I've noticed when I go to nursing homes, when I go and do a house call, the people who live the longest and are the healthiest are the ones who are happy, the ones that are laughing. They always have a smile on their face. They always have something to joke about. And perhaps there's more anger issues with the younger crowd, but
Boy,
it's something we see.
You are so right, Phil. You know, I go when my mom is at St. Luke's, and you know, some of our family at St. Luke's, or even Mountain City, or any nursing home, and you will see those people who are playing bingo, happy, talking, you know, reminiscing, etc., and always doing their puzzles, etc. And they're happy, you know, and you will even say, "Oh my God, I feel so sorry for them." But really, they're saying, "Feel sorry for that person." They have to go out in society, and you know, and they're having a great time. And of course, all the caregivers are fabulous at those places. So you see that. I mean,
You know what's interesting, Sam, and I hate to sound old school and old-fashioned, but our elderly have one thing that our youth does not. They have a faith in a higher power.
Yeah.
And for some reason, we do not see that in the younger crowd. We've somehow fallen off the track. But the older people, when I visit them, they're still grasping their rosaries, they're still saying their prayers, they have a belief in a higher power. And I think that that's crucial.
I think it's more than crucial, and that's the sad part. I think what happens is when people are blessed, young people are blessed, and they're going and getting jobs that you and I worked many years to achieve, and they're getting all this big money, etc. They forget about the faith that that they need for their families, and I really feel I feel sorry for them, Phil.
You really do. And if you study and think that history is going to repeat itself, we are actually in the Roaring '20s right now.
Is that
and when
right?
you think about it, the Roaring '20s, it was a lot of excess, stock market going up. People would just kind of live their lives, abandon a higher power or a faith system. It was, to some degree, an amoral society. And what happened? It crashed.
Yeah.
And you get that sense that we're going to crash again. We can't keep going on like this.
It's unfortunate. With this seasonal disorder, how would I know if I have it, if I had that seasonal?
Well, you might not. That's the tricky thing, because everyone kind of thinks they're normal. It actually requires someone else perhaps to say, you know what, maybe you should see the doctor because you're just not yourself, if you will.
Yeah.
But if you do feel sad and you're gaining weight, for example, have trouble sleeping, have trouble remembering and concentrating, you might have picked this up.
That was me on Monday when I called you.
That's right.
We do a show on Wednesday. Philip Benyo, his phone number, folks, is 570, very easy to remember, 788-MD-MD, okay? He's from the Lehigh Valley Health Physician Group, Geriatric and Internal Medicine. That's a big, long thing to say.
It is a long.
Staying with the, okay, we answered the question, are the elderly at higher risk of having this disorder? And you said,
No.
No. It's the younger kids.
It's more the younger.
Yeah. Okay, so you mentioned about treatment about the seasonal affective disorder, and that is what?
Usually it's light therapy, but again, I think what's the crucial thing, Sam, is to get a proper diagnosis. Make sure there's nothing else going on with you. It's not uncommon when we have someone drug into our office by a family member and say, so-and-so's depressed, he needs an antidepressant, he's anxious. Guess what? He's an undiagnosed diabetic, undiagnosed thyroid disorder. And so we uncover something that's reversible that had really nothing to do with depression per se, but caused the symptoms of it.
How many cases do you see a year with this?
Oh, we see it. We see this weekly.
No kidding.
There's no doubt. We see this weekly.
And so now, some cases, if they have seasonal affective disorder, do you prescribe anything in some cases?
Some cases, yes,
If they're
but
severe?
generally we keep the prescription pad in our pocket, and we would suggest some of the other things that are not going to have side effects, like socializations,
Yeah.
light therapy, things like that. We tell our older guys maybe get a girlfriend or something like that.
Yeah.
Things along those lines.
Yeah.
Something
Help.
simple.
It's funny. When I was living in Pardeesville, and my wife, we had the kids, and then we moved down the valley. But the point was, I would tell my dad, well, we're going out for Saturday night dinner. We would go out, and so he said, what does a dinner cost you? I said, Dad, let's not worry about what the dinner cost, But we went out with our friends, and we had a good time. We laughed. We used to go to Holiday Inn and dance, et cetera, et cetera. And so I said, to me, I couldn't put a price tag on the dinner, okay? Right. It wasn't, even though you want the food to be great, but it was just laughing, talking, and socialization. My wife stays very active every day, talking to her friends and helping. And say, you got to keep active. I mean, I can't stress that enough, Phil.
And it's a good point, Sam. Going back to what's this generation different than an older generation. who has supper tonight
Yeah.
with a family? Who goes to church regularly as a family? How many family things are being done today as families? It's very rare, and that becoming disjointed, if you will, again, is one of the fallbacks of today's youth. And as an interesting point, I read an article on tattoos. As you know, we're seeing younger and younger people getting more and more tattoos, and you think, what is it about a tattoo? Well, a tattoo is permanent. It doesn't go away. It won't leave you. And the theory is that the psychology of today's youth, because maybe there's no family, because maybe there's no church, there's no cement between the bricks, they feel abandoned, they feel insecure. So they're reaching for something that's permanent, a tattoo. Can you believe that?
Well, I have mixed emotions about it. Sometimes I see some lovely people, men, women, that, they feel a tattoo. I could see maybe a memory of their mom or,
Sure.
Something like that. But some of them, maybe go to a little extreme, but that's their own personal life. But that's an interesting
It's
thing.
interesting psychological explanation.
What happens then, see, in your family, your mom and dad and my mom and dad, and they didn't permit that to happen. They didn't. We sat at the table, we weren't picking the paper up at that time and reading the paper and not paying attention to discussion, because then you got a backhander, okay? But yet you will have our children or sit at the table and they'll be on their phones. And you're trying to have a conversation and they're worried about, texting the person who's maybe right next to them, This is crazy, isn't it?
Again, getting back to basics, it's old school, but I don't know, old school worked.
You can see it. I don't know where we're going. Healthcare. We come into this area now. You're hearing a lot of things about the flu. Okay. All right. So, what are we doing about the flu?
Well, it's tough because the flu shot's only about 30% effective. For those that got them, they're still getting the influenza virus.
What happened?
Well, the bug changed. There's a first name and a second name to the flu virus. And when this flu shot was developed, we developed it based on what the flu was doing in the southern hemisphere of the earth. However, the virus decided to change its name, and now the shot is not as effective. It's better than nothing.
Yeah.
You may still get the flu, it may not be as bad. Mm-hmm. We've had several cases in the hospital. I think there's a minor epidemic of influenza and viral illnesses. One patient of mine had a heart attack, another one was on a ventilator, all because of the flu. It's a tough one this year.
Okay, so what do we do? What do we do to prevent getting the flu? I don't know if that's such a thing, but I mean, what are some things we should be doing?
Well, first of all, if you're sick, stay at home. Don't go out gallivanting around if you're ill and spread it. Wash your hands frequently, because often that's some of the ways it can be transmitted, although it's generally from someone who coughs or sneezes and aerosolizes the virus. And if you're sick, seek a medical prevention. And in terms of if you have the flu, we have a great antiviral out there called Tamiflu. And I have to tell you a story. Last year, I was driving home, and I'm coming down with the flu. I know it's the flu. Headache, muscle aches, pains, feeling like you got hit by a truck. As soon as I get home, I took a Tamiflu, went under the covers. Sam, nowhere to lie, the next day I went to work. Wow. Completely. Tamiflu will abort it, but you have to have it on hand, and you have to take it immediately with the onset of the symptoms. But that's probably your biggest ally at this point.
What about diet?
Well, I think staying healthy in general is going to be a cascade of things: diet, exercise. And to be honest with you, Sam, I sign 3 death certificates a week.
Whew.
Right? And guess what? There's a lot of skinny people.
Bring me down now?
There's a lot of skinny
people.
You're
trying to depress me on this show. This is supposed to be an uplifting show.
No, it is uplifting. I'll tell you why. Because there's a lot of skinny people in the cemetery, and there's a lot of people with normal cholesterols in the cemetery. Yeah. We are here for a visit. Yeah. And I'm sorry. I think you should, within moderation, eat, drink, and be merry. And don't become so neurotic.
That's why you're my doctor.
Don't become so...
I keep telling people, that's why Phil Benyo's my doctor. You know what they say, fat people, when they get sick, they get skinny. So when skinny people get sick, they die?
Exactly. We're here for a visit, and within moderation, eat, drink, and be merry, and within moderation. And there are too many neurotic people worried, and perhaps it's our fault that we're saying do this, do that, do this, do that. Guess what? It doesn't matter.
Yeah.
It doesn't matter.
You know, Phil, you could, we're talking about how many years you did the show, It's Your Health, since in 1995 or whatever. And throughout the years, as a doctor, you see so many different things, okay? One of the people you pronounced dead was my father, okay? And, it just breaks your heart when you have to do that, okay? But my dad was the kind of guy that just, he didn't really want to go to doctors, and which is not a good thing, okay? At least as we talk about, in the last show we did, it was once a year get to that doctor and get what you have to do, right?
Right, and it's just like a car. We have so many miles on our body and get those things checked. And I don't want you to, the idea of eat, drink, and be merry is not to live life without abandon. Yeah. Just do it within reason and do the things that you're supposed to do.
When we grew up in Partysville, the Italian family, we had wine, at all of our meals, okay? I was 8, 9, not that I drank a glass, but we had wine and just socialize, They were priceless, they were priceless dinners. I don't care what we ate, but the fact that all the relatives were around and you had your screaming matches, you had your loving matches, but when you were done, you were energized.
Exactly. And it's interesting that wine a day, there's a thing called a French paradox. The French eat more cheese and higher cholesterols than Americans, but they have lower heart disease and cancer. Why? It's that glass of wine. Instead of milk or anything else, soda, they have wine at their table.
Folks, I'm talking to Dr. Philip Benyo, and remember 24/7 you watch the Sam Lesante show, but also his show, It's Your Health, gain a lot of knowledge. And let's get the wine out now. When we come back, we'll have a glass of wine. We're going to go for a break. When we come back, we'll probably be drunk at the time, but just come back after our break. Welcome back to the Sam Lesante Show, folks. My guest today from the Lehigh Valley Health Network Physician Group, Dr. Philip Benyo, Senior, no stranger, of course, to SSP TV. We talked about the seasonal affective disorder. You know what you have to do if you feel it. And, just get out there and have a good positive attitude and enjoy life. And I say when you call your friends up, talk about something good. Give me some good news before you tell me the bad news, okay? And I think people, that misery loves company thing, Philip, it just drives me crazy, especially people who gossip, they gossip. Well, let me tell you about Philip Benyo. Well, I got a better one about Philip. Let me tell you about Sam Lesante, okay? And no matter, and then they just get themselves depressed, okay? So what are some New Year's resolutions we should be talking about other than me having a glass of wine every day along with my scotch?
I think you keep it simple, Sam. Recognize that we're here for a visit. We're here just for a visit, and it's a very short visit, let's face it. And don't take yourself too seriously. I think you need to renew your faith in a higher power, whatever that may be. I think it's out there, and by, again, relinquishing yourself to a higher power, that's another key element to longevity. I see it all the time. The people who pray together, they live longer, in whatever belief system that is. And again, I wouldn't get caught up on the small stuff. Just eat, drink, and be merry within moderation, and get your checkup.
But don't smoke.
That's a problem, yeah. There is no way around that. I think tobacco products are just, should be outlawed. That's all there is to it. And what's interesting? We talked about this earlier, about the adolescent brain. The adolescent brain is so susceptible to noxic substances, whether it be physical abuse, be it verbal abuse, be it alcohol, particularly things like marijuana. It's unbelievable. We got to protect our youth a little bit more.
Philip, here's what I can't understand. We have the states that are, passing the marijuana. I mean, now, there's a lot of doctors like you in these states. There's a lot of intelligent people. I mean, is money more important than the welfare of these people? I mean, they say, I know medical marijuana, let's put that aside to a degree, okay? But, for recreational purposes, what it's doing, I think we're going to pay the price for that, Philip.
It's the roaring 20s. Just like I said earlier, there is no more boundaries anymore. It's everyone for themselves, and you're not going to tell me what to do.
You know what we don't hear in the news? We don't hear all the sad stories of these families of people who got addicted to marijuana, went on to heroin, went on to cocaine, and you won't hear those things. You see, just like Planned Parenthood, you won't hear those poor people that had abortions and how they suffered in life and continue to suffer. You don't hear those things, okay?
I have one piece of advice for anyone out there in television land listening. Rent the movie Mr. Destiny. Mr. Destiny is one of the finest movies out there. And what it does is it talks about this youngster who struck out with the bases loaded while in high school. And he went on a certain path in life. And then they replay the movie because he was sad with his life the way it turned out. They replay that movie with him hitting a home run and going into a different path of life. And just to show you how one event early on in life puts you on two different paths. Mr. Destiny.
And that's where we go about attitude. If you want to take the high road, you can take it. If you want to take the low road, if you want to smoke the drugs, you can do. So I always told my kids, surround yourself with people who are positive. If you see a negative, address it right off the bat, okay? Well, Philip, it's always a pleasure to have you. I like to bring your ratings up on your show. And watch the show, folks. It's Your Health with Dr. Philip Benyo, his lovely wife, and his son. They do a great job. It's always nice seeing you, Phil.
Always our pleasure, Sam. Keep up the good work.
And Phil is with the Lehigh Valley Health Physician Group, Geriatric and Internal Medicine. His phone number is 570-788-MDMD. We'll see you next time.